The St. Lucia Employers Federation has raised concerns about a troubling trend of employee absenteeism and perceived abuse of sick leave. The Federation spearheaded a roundtable discussion to address the issue.
At the end of it all, we decided that although we were not in a position to provide evidence of sick leave, that the view was shared that in some form or another, there was some level of abuse of sick leave. Going forward, we will have another consultation in which we will have a lot more data to share with our members and decide on the way forward.
Executive Director Jerome Jules says employee absenteeism is a major concern for businesses, driving up operational costs.
Since when employees are absent, they need to either hire new employees or they had to meet the cost of their sick leave.
So it's a significant...
It is a significant issue for our members, and over the years they have been complaining that they are aware that some employees are abusing sick leave. In fact, what that means is that they think that there are certain employees who take sick leave when they do not. They also suggested that maybe that some persons were getting medical certificates when that may not necessarily be so. We have not been able to prove that at this meeting because, again, the evidence was not forthcoming. So we have decided that most of the people here would go back to their various organizations and to set up systems for collecting data that would allow them to establish that there is, in fact, abuse of sick leave in St. Lucia.
National Insurance Corporation statistician Paul Kalisharan provided data on sickness claim trends.
What we have noticed is prior to COVID, we were at, say, between 10,000 13,000 claims. And then during COVID, it went down to about 15,000 16,000 claims, and then thereafter it shoots up to between 26 to 29,000. So definitely we have seen an increase in sickness claims, and so what we were looking at is the possibility of abusing sickness, but NIC, for our purposes, we pay sickness claims and we report on the number of claims that we pay.
The industries most impacted.
We noticed that a lot of the claims came from the hotel, restaurant sector, from the wholesale retail sector, from the government sector, public administration. These were the economic sectors that account for the greater proportion of claims paid.
Is that a serious concern that NIC has?
For sure, the increase in claims paid, it's given the significant jump in expenditure from 9 million to 15 million. It is a concern.
Stakeholders at the roundtable discussion included the Medical and Dental Association, National Insurance Corporation, National Competitiveness and Productivity Council, National Workers Union, and the Labor Department.
The reason behind what they perceived that increase was, basically. But on the part of the department, the reason why we basically came here to bring clarity to the discussion as it relates to the law. Section 143 of the Labor Act speaks to the abuse of sick leave or incapacity, and we wanted to bring some clarity here at the department how an employer more or less can go the right procedure an employer is supposed to use to go about proving if an employee is abusing sick leave or not, and what can be done if that employer can successfully prove if that employee is abusing sick leave.
The Employers Federation is expected to issue a report with recommendations to address the growing trend of worker absenteeism and perceived abuse of sick leave.